Hi, I'm Dr. Melanie Palm from Art of Skin MD in San Diego, California. And today we're talking about botulinum toxin, in this case Botox, for platysmal bands, or these little neck bands that we get over time. So we've got a lovely patient here. I'm actually going to have her grit down on her teeth a little bit. And you can see these little bands. And this is something that we can soften. Our neck band, or our neck muscle called our platysma, goes all the way from our jawline to our collarbones, and over time it tends to form these little bands. So I'm just going to do little baby injections as we go along. So you pipe down again for me and relax. And we're typically doing about 1 to 2 units in this case of onobotulinum toxin, which is Botox, to these areas. And it's real easy. We're just going superficially. Grit down again for me. Good, and relax. And sometimes it lasts a little bit longer than traditional Botox, which we do on the face. It takes about a week for it to kick in fully. And then grit down for me again real big and relax. We're going to work on this band that's sort of right straight in the midline. And I use a super tiny needle, so this is a 31 gauge needle. It's actually an insulin needle that we use for administering the Botox, or sometimes we use this for Dysport too. And it's very comfortable for the patient, which I think is really important. And the chance of bruising is very small when we do this. I'm going to come over to the other side to do it. And then give me a big grimace again. And you can see those nice little bands, and relax. And work on this side now. And recovery, there's not much. I do tell the patients, if they can, to practice the muscle movements of the muscle that we're actually treating. So in this case, I would have this patient practice kind of that grimace a little bit. Over the next hour or so, there's some thought that maybe it helps the Botox be a little bit more effective in the areas that we want it to be, and it may last a little bit longer if you do that too. And I'm just rounding out this last band that we're actually going to treat. And this is really a nice way of non-surgically rejuvenating the chin and neck area, because sometimes when we treat this neck area, it actually lifts the jawline a little bit by treating some of these bands that are pulling things down. But easy procedure to do, and I think real crowd pleaser. We're doing a lot more and more of this. So if you have questions about using Botox or Dysport in the neck, give us a ring at 858-792-7546, or you can look us up on the web. It's at artofskinmd.com.